Malaria has been a major cause of poverty and low productivity in Ghana. The disease accounts for about 3.2% of all outpatient department attendance and 48.8% of children under 5 years admissions. Averagely, a member of every household in Ghana has ever been infected with malaria. Rukaya Al-Hassan is a resident of Old Fadama, a suburb of Accra. She tells me her second child died from malaria this year.
He was sick of malaria and we took him to the hospital, but we did not have money. So the doctors did not attend to him and he died.
She is still struggling to come to terms with her loss. Ibrahim Sani also lost his wife to malaria.
My wife complained of headache and was diagnosed of malaria. She died a few days later.
Even 4 hours. Attempts to control malaria in the country began in the late 1950s. It was aimed at reducing the malaria disease burden till it's no longer of public health significance. Today, Ghana is implementing a malaria control program with the aim of reducing death and illness by 75% by the year 2015, in line with the attainment of the Millennium Development Goals. The program is geared towards overall health sector development, improved strategic investment in malaria control, and increased access to malaria treatment and prevention. Though this multi-sectorial approach has helped in reducing the infection rate, malaria continues to be the leading cause of morbidity in the country. The Noguchi Memorial Institute for Medical Research conducts research in malaria control and prevention.
Now we've been able to sequence the genome of the parasite. You know all the genes which market the parasite. And we have seen that the parasite expresses on specific genes which are the one which more or less are responsible for those severe forms of the disease. And therefore, we are even trying to see whether it is possible to develop what we call a syndrome-specific vaccine, where we look at those genes that we have seen, whether we can prepare some vaccines against those particular genes. And therefore, we are able to do that. Then we can prevent children from getting the severe forms of the disease. Because if you have the disease and it won't develop into severe forms, then it will be a major issue. But when it will develop into severe form, that which can result in death, that's our major problem. So if you can develop something against the syndrome-specific one, then that's fine. The same thing happened with pregnancy malaria. If you have the first pregnancy, your chances that you won't be able to withstand the parasite because you don't have any underlying immunity again to fight the disease. But in the subsequent pregnancies, because you have encountered the parasite, you have seen the type of receptors that they are expressing to allow them to bind to the placenta, then you'll be able to protect yourself. So based on that, our research is also showing that it's also possible to develop what we call syndrome-specific, like pregnancy-specific vaccine.
The inflow of funds for continuous research in this area is few and far between. According to the World Health Organization, funding for malaria programs has increased in recent years. But despite these increases, available resources still fall far below global targets. About $5,100 million is needed each year in order to ensure universal access and to make research institutions like this to be more effective. The director of Noguchi, Professor Kojokuram, is advocating for the establishment of a research fund to support research institutions in the country.
Other countries have research funding bodies. So you have South Africa, for example, has a Medical Research Council, they have the National Science Foundation, they have all this. So the government in this budget will say that this year I have $2 million or I have $5 million, whatever the amount given to this body. And then the body sits down and says, okay, for this year or for the next 2 years, we want solutions to these problems. So people in the various research institutes, please bring grants, bring proposals, which will be evaluated to see whether what you are saying is feasible or not and things. And when you've gotten the money, people will come and see that you're doing the work and things, and it goes on and things. Now that we are middle income, maybe some of the middle income monies will be set aside for research.
The need for government to restructure its medical research policy to attract funding has become important.
Sometimes the absence of a focus makes it difficult for funding. But the moment government re-articulates its policy on malaria treatment and research in whatever way, it will attract collaborating agencies. I know, for example, that the WHO has an ongoing research network on tropical diseases.
While experts continue to research in malaria, there is an individual responsibility to keep the environment clean, sleep under long-lasting insecticide nets to prevent the disease and avoid needless deaths, like Rukaya's son, Thomas Naadi Bitlegma, Varsat 1 News.